70 to 90% of children born with spina bifida also develop hydrocephalus. Today, we are going to explore the facts of hydrocephalus. We will first find out what it is in different types, then how to control it and what a shunt is, how you can get it and who can get it, and finally the symptoms of hydrocephalus. Hydrocephalus is an abnormal buildup in the brain of the brain's water-like fluid, or CSF. There are many different types of hydrocephalus. There are congenital hydrocephalus, acquired hydrocephalus, and communicating or non-communicating. Congenital hydrocephalus is present at birth or may be caused by either events or influences that occur during fetal development or genetic abnormalities. Acquired hydrocephalus develops at the time of birth or at some point afterwards. This type of hydrocephalus can affect individuals of all ages and may be caused by injury or disease. Communicating hydrocephalus occurs when the flow of CSF is blocked after it exits the ventricles. This form is called communicating CSF because the CSF can still flow between the ventricles, which remain open. Non-communicating hydrocephalus, also called obstructive hydrocephalus, occurs when the flow of CSF is blocking along one or more of the narrow passages connecting the ventricles. The most common way to treat hydrocephalus is the surgical diversion of the excess fluid by placing a synthetic tube or a shunt into the ventricle. There is really no cure for hydrocephalus. Another treatment is a third ventriculostomy. A shunt is a narrow tube that allows excess cerebrospinal fluid that has built up inside the skull to drain out into another part of the body, such as the heart or abdomen. To drain excess CSF, shunts are inserted into an opening or pouch inside the brain called a ventricle, just above where the blockage is that is preventing the CSF from properly flowing. Shunts are named according to where they are inserted into the brain and where they are inserted to let the excess CSF drain out. Although generally not hereditary, hydrocephalus is either present at birth, congenital, or as a result of injury or trauma to the brain, acquired. The number of people who develop hydrocephalus or who are currently living with it is difficult to establish, since the condition occurs in children and adults that can develop later in life. In a 2008 data reviewed by the University of Utah found that in 2003, hydrocephalus accounted for 0.6% of all pediatric hospital admissions in the United States. Some estimates report 1 or 2 of every 1,000 babies are born with hydrocephalus. Hydrocephalus can be present with many different symptoms. In infants, symptoms can range from mild irritability and sleepiness to more severe symptoms such as seizures, vomiting. Most noticeably, hydrocephalic infants will develop a bulging and abnormally large head, which occurs because infants' skulls will expand to help accommodate the excess CSF. In older children and adults, hydrocephalus may be present with a different host of symptoms because their skulls cannot deform to accommodate the excess CSF. These symptoms include issues with walking, urinary incontinence, and progressive mental impairment and dementia. In conclusion, with all the facts that you have just learned about hydrocephalus, hopefully you know a lot more about the disease and realize that it is highly deadly.